coronavirus is real.
Social distancing is another protective measure in the fight against COVID-19.
Stay home, stay safe. Let's fight COVID-19 collectively.
Adhere strictly to all measures of preventing outbreak and spread of COVID-19 in Borno State.
This message is for all Nigerians. Let's collectively fight COVID-19.
This message is brought to you by Northeast Multi-Sectoral Crisis Recovery Project, Medically Borno State.
Hello viewer, and welcome to the maiden edition of COVID-19 Awareness Studio, a public sensitization health outreach program supported by MCRP Borno State. On the program, we are going to talk about COVID-19, otherwise called coronavirus. I am Muhammed, your presenter. Thank you very much for joining us. Now, joining me on the program to discuss this and other issues with regards to the issue at stake, Dr. Muhammed Ghuluze, the Chief Medical Director, Hospitals Management Board, and Dr. Sule, Meleh, Executive Director, Borno State Primary Healthcare Development Agency. Doctors, you're welcome to our studio.
Thank you for having me.
Yes, I would like to start with you, Dr. Muhammed Ghuluze. Now, what is COVID-19 or coronavirus as it is widely said?
Well, COVID-19 is a viral disease.
Yes.
In fact, COVID-19 means coronavirus disease 2019.
Okay.
Is a member of the family of viruses that cause respiratory tract infection.
Yes.
Ranging from the common cold, the catarrh, what we call catarrh locally, but it's called common cold or flu, and up to the most severe member of the family, which is the acute respiratory syndrome, or another form of very severe one is the Middle East respiratory syndrome, MAS. So this particular viral disease, coronavirus, is a disease that has never been characterized before. It's a new, that's why it's called novel, and this is the first time it has been characterized,
Yes.
and so it has never been known before. So this is the virus disease.
Okay. Now, Doctor, you made mention of the disease having a characteristic like just a common cold or catarrh. So how can a person be able to differentiate between the virus and then the common cold?
Well, the common cold, even though it also causes some symptoms similar to this coronavirus disease,
Okay.
but it's more severe as compared to the common cold. The coronavirus disease has a range of symptoms from the running nose,
Yes.
cough, and most importantly, the difficulty in breathing,
Okay.
which is not common with the common cold. There is also a fever, which could be high or low.
Okay.
So this it is on the higher side as far as the symptoms are concerned, and of course its virulence is more than that of common cold.
Okay. Thank you very much, Doctor. Let me come to you, Dr. Sule. Now, this COVID-19, otherwise called coronavirus, how does it come into being?
Yeah, thank you very much. I think the virus first, just like my colleague has said,
Yes.
it's a new virus. The first cases were identified or seen in a region of China. From there it spread. Up to now it is not very clear exactly how it came about, but most scholars agree that it is a spillover from animals to humans.
Okay.
That is what it is.
Just like
agreed on now.
diseases.
Yeah.
Okay.
So from there it spreads to other countries gradually. So in our case here, apart from the symptoms, what is important is first and foremost, it is not here in most of the places, and in almost all the places outside China, it is imported by people traveling from areas where there is that infection to areas where there are not. And if you remember, this is how it started spreading to countries, to continents, to countries, and then within countries between contact of those people that imported the disease in the first place.
Now, you made mention of this disease emanated from animals, then later transferred to humans. Now, how true is it that it is a man-made disease to destroy some countries, especially economically?
Up to now, there is no proven, scientifically proven case to say that this is a man-made virus. There's always an argument that no, it is not. Coronaviruses are known viruses for centuries, only that this one is a different species that they were thinking it's because of the close contact between humans and animals that sometimes we have these diseases crossing from animals to humans, and this is how it is suspected that it came about. But the effect, yes, it's devastating. It has devastated the economies of so many places because of the way it spread so quick. This is a novel virus. Nobody knows about it before then. So the effect is definitely beyond the health sector. It has affected the economies of so many countries. It has affected even the local economies in so many places. And it has brought about a lot of social changes within communities.
I'll still come to you. Doctor, since we're talking about this coronavirus, the COVID-19 issue, now let's get to know more about this coronavirus. How is it contacted?
Well, how it is contacted is through direct contact with the person that is infected. It is present in droplets. For example, if somebody that is infected sneezes or coughs, it is produced in the droplets. So if you are in the vicinity, very close to the person that sneezes or coughs, you can easily contract the disease. Then there is also direct contact. That is from shaking of hands or touching contaminated surfaces. And also you can have, for example, garments that is being contaminated. So there are so many other ways. That's why it is being advocated that you should have some kind of distance between you in the range of 1 meter, so that because it doesn't travel very far, the droplet, so then you can avoid having contacted it by that distance. And then that the essence of saying no shaking of hands is also as a result of this, you can contact it through shaking of hands, contaminated hands. So that's.
Now, initially you made mention of some signs of this coronavirus that have been so similar to colds and catarrh.
Yes.
Now, if somebody now contracts the coronavirus, what are the immediate signs and symptoms of this coronavirus?
The immediate sign will be runny nose, cough, headache, fever, and then maybe now you have body pain, what is called the muscle pain, and then other conditions, late conditions like difficulty in breathing. These are the symptoms that can make you suspicious of having this disease.
How long do you think that this can take for one to actually manifest the disease, to manifest on somebody?
In fact, one day you can have these symptoms, but commonly within the first 5 days or the 5th day, but it can take up to 1 week or even 2 weeks. That's why people are quarantined if there is any suspicion, quarantine for 2 weeks, because it ranges from 1 week to 2 weeks. That is the incubation period.
Dr. Sule, this coronavirus, is it curable?
Presently, there is no known cure for it. There is no vaccine to prevent it, but a lot of work is ongoing. That is why the goal of curing now is preventive. It's all preventive measures so that you don't acquire the virus. It is right, because right now there is no known cure for it and there is no vaccine developed for it yet. And importantly, just like my colleague said, it is important to know that a great number of people may not even show symptoms or severe symptoms. Some have mild symptoms that they may not even notice, but they can spread it. Some have moderate symptoms that may not be so severe to require hospitalization. And then there are those that may develop very severe symptoms.
Now, there are people who actually, sometimes they use bitter seeds, some substances that are bitter, and they believe that these are some preventive measures against this coronavirus. Do you believe in that?
Again, just like I said, there is no known treatment for it, no vaccine for it. So naturally, when something is new, people go to try a lot of things. Even in the scientific world, if you look at it, there is a lot of trial on some drugs. Some will claim there are some successes in it, but then generally there is no clear consensus among the scientific community that yes, these drugs have shown a lot of promise to treat coronavirus disease.
Doctor, what is the situation with regards to the coronavirus issues globally? Is it on the gain or is it under control?
Well, as you can see, reports coming out from various countries reveals that there is still a lot to be done in the issue of control. It is still on the increase. In some countries, a plateau has been reached. That means near control has been reached, with the exception of China, that has can be said to have controlled the disease. No other country has reached that level yet. So it is still a case that everybody has to worry about. So it is still on the increase in many countries. Death rates and the case fatality and other forms of the increase in the number of cases on daily basis.
Now, how dangerous is the coronavirus itself?
Well, initially, from what we used to hear from China, initially the fatality rate is 2%. But as we moved away from China, it is becoming a more serious and deadly disease. You can see that it is more than 5% death rate. So it is a very virulent and deadly disease, although it is can be said to be moderate as compared to the acute respiratory syndrome and that of Middle East syndrome. So, but from what is going on, we should assume that it is a deadly disease.
You're watching the television service of Borno Radio Television Degree, and it's a special program, awareness and sensitization program, an outreach program supported by MCRP Borno State. And we've been taking with Dr. Muhammed, Ghuluze, the Chief Medical Director, Hospitals Management Board, Borno State, and Dr. Sule, the Executive Director, Borno State Primary Health Care Development Agency. And we're talking about the issue on stake that is called COVID-19, otherwise called coronavirus. Dr. Sule, now let's talk about the people who are at risk of contracting this disease. Who are at risk?
First and foremost, everybody can get infected with it. There is no age that is exempt from infection by coronavirus disease. People at risk mostly are people that have low immunity, probably people that are aging. As you age, from the age of 50, 60 and above, your immune system becomes weaker, not as a younger person. So they are at risk. People with underlying disease conditions, let's say they have an existing lung condition or anything in the respiratory system,
like pneumonia, asthma,
yeah, something like that, And then people that have chronic diseases also, like maybe a heart disease or anything that will compromise their capacity to breathe normally, because it affects the respiratory system as well as other organs as well. And then also affects people, of course, low immunity means people that are not properly nourished and all those things. But then this is no exception that young people are not infected. We have seen mortality even in younger age groups, but it is more in people that are elderly and have underlying conditions.
How about children?
Children are affected. There are few deaths among children, but it is important to know that a lot of transmission happens between children and parents.
What is the immunity level? Is it up to?
It is expected that the younger you are, the better immune system,
the chance of survival
is higher than when you are very elderly or have a lower immunity.
Doctor, who are the most vulnerable, and then why are they vulnerable?
Well, thank you so much. Just like my colleague said, everyone is having equal chances of getting the disease.
Definitely.
It's just that maybe if you are not having any close contact with anyone that has it. But those who are vulnerable can be said to be a certain group of people whose jobs are to attend to this kind of people, and particularly all forms of patients. Now, before a patient comes in contact with health worker, for example, the diagnosis is not known, and the health worker will assume just like any other patient and attend to such patient, and only to know thereafter that that patient is infected with coronavirus disease. And so the health workers are actually very vulnerable to this infection, and also all those who are used to be in close proximity. For example, in celebration or any kind of festivity, in this kind of situation, you will not be able to know who is infected and who is not infected. And so any that is in that kind of gathering will be vulnerable to contract this disease. So that's why emphasis is laid on people not to have close contact with anybody. Festivities should be abandoned or at least avoided. So these are people that are, so he has already talked about the elderly and those who have underlying disease.
Now, Doctor, the issue of social distancing is very, very effective in the case of actually preventing oneself from contracting the disease. Now, if you come to the issue of places like Africa, our culture, our social life, our values, religion, is also another deficiency in actually trying to maintain this social distancing. Now, how does it affect our cultural and then religious life, this social distancing?
Yeah, it affects that a lot because in this part of the world we are used to a lot of gatherings, be it for religious reasons or cultural reasons. We go to mosques, we go to churches, and all those places. And then that brings congregation of people around. And once people are, if there's an infected person, the likelihood of him spreading to others is high. That is why if you look at some states have taken the drastic measure to the extent of closing places of worship, scaling down on mass gatherings for weddings or for any celebrations, so as to curtail this. But yes, in some contexts it is a very difficult thing to do, but you have to look at the risk versus the chance of allowing that thing to happen. So in most places that they have these cases, they have to take that measure as drastic as it is.
Now, what are the social, educational, and economic effects of this disease, if any?
So it has disrupted a lot of things. If you remember, there are a lot of school closures even before the end of the school calendar year. There is disruption of market activities in some places. There is a disruption of going to places of worship or something. So these are things that are very new, and certainly it will affect the social well-being or the social activities of people as we know it before.
Okay. Now, Doctor, let's take a look at the situation of this COVID-19 there in Borno State. Now, do you think the level of compliance by the people with regards to the social distancing and the enclosure of places and gatherings, now, do you think this will actually help in reducing or rather curtailing the spread of coronavirus?
Thank you so much. I think in the case of Borno State, we are a bit relaxed because the disease is yet to reach here. Otherwise, what you hear in other places where these diseases are available is something to worry about the social life that we are exhibiting. For example, weddings.
Yeah.
You go to weddings, see people hugging each other, shaking hands, sitting close to each other. These are things that are being discouraged. And so in Borno State, I think we thank God that it is yet to reach here, but I think there is going to be more stringent measure to ensure that social closeness or associations will have to be curtailed beyond what we are doing now, right now.
Is there any possibility that this pandemic is going to reach Borno, or it will be averted?
We pray that it will be averted.
Okay.
Yes, but like we said,
yes.
Why His Excellency ensures that the borders are closed is to ensure that these diseases are not imported.
Okay.
All right, they are not brought in by travelers, because that's the vehicle for this disease to enter into any country or any state or any community.
Okay. Now let's talk about the most important thing, the preventive measures. What are the preventive measures or control measures being taken?
Well, it is on various stages. First, the government has instituted a lot of measures to ensure that this disease is curtailed even before it reaches here. And when it reaches here, this disease is nipped in its bud. It has closed the borders, like we said, that nobody comes into Borno State and nobody goes out. So that is to ensure that the citizens are protected. Two, it has established a center for management of these cases if it eventually happens.
Yes.
Three, it is sensitizing the whole community or the whole population to ensure that everybody knows what the coronavirus is up to and how you will protect yourself and so on. It has also mobilized some resources to ensure that protective equipment is procured and distributed to the vulnerable people, like the health workers and so on. And then at the community or population level, there is a lot of jingles, enlightenment going on to ensure that the people do the right thing. And what are the right things? How do you protect yourself so that you don't contract the disease? The social distancing is one. Washing of hands, regular washing of hands. Whether you met with any suspicious case or not, you regularly wash your hands. And then, if the soap and water is not, the water must be a running water. So if soap and water is not available, you have sanitizer, you use sanitizer to rub your hands to decontaminate the hand. And so if somebody, whether it's common cold or not, provided it is coughing, you cough into the handkerchief or tissue and then dispose it immediately. If that is not available, you cough into your flexed elbow so that you don't spread it to other persons. So, where available, you are also encouraged to use mask, face mask, so that you don't give it to another person or you don't get it also. So a lot of preventive measures have also have been put in place. Yes.
Dr. Sule, would you like to add anything to these preventive measures?
Yeah, I think just like you said, Borno State government have taken a lot of proactive measures, even before some other states have started.
Yeah.
We started screening at the airport for people coming into the state much earlier than most states.
Okay.
And then we take proactive measures even before the federal government announced the closure of the international borders, because we have some border towns that are at risk more so at a time when Chad, Cameroon, and Niger have cases as well. So we took those proactive measures. And one of the important things that is happening is what we are doing now: continuous sensitization of the public to know that this disease is around. We have it in the country, and we have seen it in number increasing by the day. So we have to be very proactive about what we are doing. The state government has put in some measures, of which we keep appealing to the people to observe those regulations that are put in place.
Now, the state government has put in many measures just to actually prevent this pandemic from reaching to the. Now, how would you encourage our stakeholders or relevant agencies in this issue of preventive measures?
Yeah, the high-level committee inaugurated by His Excellency the Governor is all inclusive of people from all ministries, all line ministries, all sectors, the traditional institutions, the religious institutions, the military, and everybody. So it's everybody's job to collectively work toward preventing coronavirus from coming into the state. And if it comes, these are the steps that people will take. This is the steps that the different sectors will take to curtail any further spread of the disease in the state.
All right, you're watching the television service about no radio television, and it's a maiden edition of our COVID-19 awareness, a program designed to create awareness on the dangers of COVID-19, a program supported by MCRP Borno State. Now, Doctor, like you have rightly said earlier on, that we are yet to have, or rather, although there is no case reported here of coronavirus here in Borno State, maybe there are insinuations that probably the virus cannot withstand the high temperature as obtained here in this kind of area. How true is it?
Well, I think I will say there is no research that indicated that the temperature we have will prevent the disease from contracting, from attacking on anybody, or disease from spreading in this kind of weather. But we have a scenario where we have countries that have temperatures maybe equal or more than what we have, and are having this disease. Countries like Algeria is very hot, Saudi Arabia is hot, Sudan. There are so many countries that are maybe as hot as ours, or even more humid as ours, but they have this disease. So people should not misconstrue this kind of statements with regards to temperature. In fact, the temperature they are talking about is maybe if food is contaminated, for example, and it's being cooked, it doesn't withstand that kind of, it doesn't even reach the boiling point. At 70 degrees centigrade, this organism dies. And so maybe also the surfaces which are contaminated, if it is in the kind of heat that we have, it doesn't stay longer, as it may stay in cold climate. So this may be the issues as regards temperature, but not when it reaches the human. In fact, by the way, the body temperature is 36 degrees centigrade. And so some are talking about 26, 20 something that the organism does not stand. So it doesn't hold water. So I think the best thing that people should do is to ensure that they protect themselves. They should not dwell on the fact that they have some environment that may not harbor the organism. this organism, like we said, is new, is yet to be completely characterized, and some of the conditions that we may be doing is speculative, and so we should not agree totally with what some people are saying. So we discourage people from insinuations with regard to this. This disease is real, and we should be very, very careful and protect ourselves.
Okay. Dr. Sule, now, is there any designated centers to refer to in case of any emergency?
Yes, there is the Brigadier Abakari Memorial Hospital in Algeria. It was designated and then equipped to receive, if there's any case in that place, for isolation and for treatment in those areas, or for managing also. And also there are some spaces also, I think about 38 bed spaces or so in the University of the Teaching Hospital, with whom we are collaborating between the state and the UNTH.
Now, Doctor, do you think that the 2 weeks lockdown ultimatum is enough to avert this coronavirus from getting into this day?
Well, I think the 2 weeks is about the incubation period, and particularly those who have already come into the state within 2 weeks. It is expected that if you had the disease, by then it should have manifested. But new entrants can still import it. So the 2 weeks is just for government to see what is the scenario, what is the situation over the country and the world over. So that will not mean that it will be the end. In fact, it may be heightened.
Yeah.
Yes.
Now, every committee has its own constraints. So what are the constraints faced by this committee in carrying out its statutory responsibilities?
Well, I think the constraint is about the attitude of people, because the whole thing boils down to non-compliance. And if there is non-compliance, people do not obey what is being advocated, and then it becomes a problem, because government and this committee will waste a lot of energy in trying to educate people, and people don't observe what is being told. Then it becomes a big problem. So that is just the constraint. Otherwise, all other things are okay.
Now, Dr. Sule, what is your impression about the lockdown imposed by government to avoid possible outbreak of this disease? General impression.
I think government has done its own.
Yes.
It has brought level 12 downward officers from coming to work, just to reduce congestion in the workplace.
Yes.
But this is not being observed. Instead of the workers to stay at home or reduce unnecessary movement, probably they go about their other engagements, which does not reduce that. The issue of reducing the number of passengers in buses and tricycles is not being observed. So these are issues that my colleague is saying. There is still a lot of non-compliance among people. A lot of people still don't believe it.
Okay. Thank you very much. We are going to take a short break. The program will continue shortly after this break. Stay tuned.
Hello Nigerians, COVID-19 is real and it's on the high side. Avoid touching your face, nose or mouth. Let's collectively fight COVID-19.
Wash your hands regularly with hand washes that have antibacterial agents in them, such as soap, sanitizer, or ashes. Coronavirus is real.
Social distancing is another protective measure in the fight against COVID-19.
Stay home, stay safe. Let's fight COVID-19 collectively.
Adhere strictly to all measures of preventing outbreak and spread of COVID-19 in Borno State.
This message is for all Nigerians. Let's collectively fight COVID-19.
This message is brought to you by Northeast Multi-Sectoral Crisis Recovery Project, Medjugorje, Borno State.
You're welcome back. You're watching a maiden edition of COVID-19 Awareness Studio Program, a public sensitization and outreach program supported by MCRP Borno State. And we've been discussing on the issue at stake, and that issue is COVID-19, otherwise called coronavirus. And I've been discussing these issues with Dr. Muhammed, the Chief Medical Director of Hospitals Management Board, Borno State, and Dr. Sule, the Executive Director of State Primary Healthcare Development Agency. Now, Doctor, I will still come back to you. For the benefit of maybe for our viewers who might have joined in just now. Now, let's talk about the issue of this coronavirus. How can a person contact the disease easily, like you said earlier?
Yeah. Like I said, the easy way of contacting this disease is through close contact with the infected person. And the close contact is when you come into contact with this person, the person is already contaminated with the virus.
Okay, like people sharing the same cloth, can it be contacted as well?
Yes. It's because the cloth may be contaminated with the virus. So you can either, and when you touch, and then you touch your eyes and mouth, nose, then you can transfer the disease onto yourself. So that is why it is said that avoid close contact with this person. If the person coughs and it comes out in droplets, if the person sneezes, it comes out, and if you are very close, it directly affects you.
Okay.
So that's the easiest way of catching and getting the disease.
Okay. Doctor, will you add anything to what Dr. has just said? Because there are people who believe in maybe in the daytime around, in the afternoon around 12 in the afternoon when the sun is very hot, they will take their chair and then they will go to the sun directly and they will sit for 20-30 minutes, believing that the hot sun will actually eliminate all the virus of the corona, if there are any.
Whatever the temperature, whether it is cold or temperature, the human body maintains the same temperature. But that doesn't kill the virus in you. And just like you said earlier, there are countries where the temperature is much higher than ours. They're suffering this outbreak. Countries like Saudi Arabia, countries like Kuwait, some part of Iran, US, they have temperatures even higher than our own. So these are myths. Now, the social media has brought a lot of untrue information, misinformation about the virus, so much so that there is an overflow of information, most of which are not right. People believe in that. And that is what some of the misconceptions.
There are some photos who actually believe that there are vaccines that are being provided to prevent people from contracting the disease. So what is your take on this kind of issues?
Again, there is no vaccine yet, specifically for coronavirus yet, but there are works in progress in so many countries. They are working toward that.
Okay. So there is a need for public awareness so that people should know that there is no any vaccine that is being designated for this for the prevention of this coronavirus.
That's right. So this is the part of the advocacy that we are doing, part of the mass communication. So for now, it's just to emphasize on how do you get the disease and how do you prevent yourself from getting the disease. You wash your hands frequently, because if you have it, you kill it with the soap and water or the sanitizer, so that you don't touch the place where another person will now touch and pick it. For example, a public doorknob where everybody going to that place will use that handle. So if you don't wash your hand, you are going to contaminate that place and the next person is going to pick it. That is the rationale of always washing your hands, using soap and water, or sanitizing with alcohol-based sanitizer, so that it will kill the virus.
How about the new way of shaking hands by the elbow?
Yeah, it's just to ensure that you don't have contact.
Direct contact.
So that probably if the person doesn't wash his hands or he's infected by the virus, it's likely to contaminate you. Okay. And then from your mouth, it's very easy now to touch parts that will now put the virus in your eyes, your nose. Yes.
Okay. Doctor, is it possible for this coronavirus to be eliminated totally or eradicated totally, just like other diseases?
Yes, and that's the effort the whole world is making, to ensure that it is eradicated from the whole world.
But that will take?
Well, it may take some time, but then it will be within the nearest future.
Now, what is your call or appeal to the public on the dangers of this coronavirus issue?
My call
need for them to prevent themselves.
My call is people should listen to the experts who are talking about how to prevent the spread of this disease, how you protect yourself, obey the methods that are being rolled out to the general public. Stay at home. This stay at home is very, very important, because if you don't go out, there is no way you can meet with the contaminated person or infected person. So stay at home. If you have to go out, wash your hands properly, and then use either soap and running water to wash your hands, or use hand sanitizer, and then avoid close contact with anybody. So that social distance is very, very important, and avoid any gathering. Avoid any gathering, because like we saw, people are just joking with this coronavirus.
Yes, definitely.
You see people saying coronavirus and then they
shake hands.
Shake hands. You understand? So you don't joke. It's because you don't know, since it does not infect you.
Even as of yesterday, when
Yes.
the banks have sealed their gates,
Yes.
allowing only 15 people to go inside.
Yes.
You see at the back of the gate, people are gathering, crowded, and they are struggling to go in. So there is this physical contact.
Yeah, that's right. So people should avoid this kind of scenario. Otherwise, honestly, one case into our system here, it will devastate the whole system. You can see the great economies of the world, how they are suffering.
Yes.
And so, prevention is better than cure. There is no way, when they say the disease has no cure, and you cannot do anything to prevent yourself, I think you are in for the trouble.
Now, for example, for an individual, for him to take this preventive measure, maybe at the family level, what is he supposed to do at the family level?
Family level, of course, if if you are sure that you have complied with all the things that are being said, the red line rules, that you will not contract this disease if you do so and so.
Yes.
And at home, you are only a close family, and it is expected that without anybody going into maybe, or has not traveled,
Yes.
is not mingling with the large crowd, and you are also employing all those things that we said you should do.
Yes.
Wash your hands, cough into your elbow, avoid crowd, social distancing, and so on. The family is protected. So it's not expected that it will just, from a dog, it will just come up. It's not like that. You must have a contact with the infected person.
So the virus travels on a human being.
Yes, you carry it. In fact, there are carriers.
Okay.
The human carriers of this disease. Those who do not have symptoms.
Yes.
So they are the ones spreading. So what we are saying is that, for example, in this environment, if we don't go out and have contact with other people and so on, this is our house.
Yes.
We don't expect that we will contract it from anywhere without anybody that is infected coming into the house.
Okay. Yes. Thank you very much, Dr. Sule. On a final note, what is your advice to the public on the dangers of this coronavirus?
Just like I said before, number one, people should be very patient, listen to people that have knowledge on this, and to be patient and abide by the rules or the regulations government put in place to protect the society. This is very important. And the measure currently taken, I think, is a first step measure. Depending on when government assess it and find out the level of risk is still high or low, it may adjust those regulations it has put in place for now. And then secondly, there are so many myths, like people saying the black race is not affected.
Yes.
I think I was reading in a report.
The coronavirus is not a disease for Africa.
There was a state in US, I think Alabama or somewhere, where the black population is only about 30%, but the death rate is 70% among the black people. So there is no saying about black people are not affected. They are affected as well as everybody.
So we even believe that coronavirus is not a disease for masses.
Well, it is imported by people that are coming from outside the country. But the greatest fear is, what about if it went into the society? Now let us learn our lesson from something that happened so many years ago.
Yeah.
Now when the AIDS pandemic happened, HIV/AIDS, a lot of people don't believe it. They believe it is a disease that is restricted to certain group of people.
Yeah.
At the end of the day, before we know it, it is all over, with all the sensitization taking place. Now at the end of the day, it is killing people silently all over. So we don't want to learn our lessons that way. We want people to believe that yes, this is something. Today the world is a global village. What you see somewhere is what is likely to come your way. So if there are preventive measures, you have to be patient and follow that preventive measures. That is the only way as it is now.
Okay, thank you very much. Dr. Ghuluze, is there anything you would like to add before we close the program?
Well, let me add on what my colleague says. Everybody is at risk of contracting this disease, whether you are high or low. So if the affluent people can travel out and import the disease can be spread amongst the community. And that is why even the federal government is very cautious about what is going on. It is observing. The fear will be community transmission of this disease.
Definitely.
So people should disregard some kind of insinuation. And let me say that false statements about this disease can aid spread of this disease. So we should avoid, and you must also scrutinize the source of any information coming into your handset or any other thing that you have, whether it's a computer or anything, because this false information will expose you to this infection.
Okay, thank you very much. Well, you have been watching COVID-19 awareness program, a program that is being supported by MCRP Borno State, and we have been discussing on the dangers and preventive measures about the issue of COVID-19, that is coronavirus. Now we have been talking with professionals and experts, Dr. Muhammed, the Chief Medical Director, Hospitals Management Board, and Dr. Sule, the Executive Director of Borno Mcrp Primary Healthcare Development Agency. Doctor, we thank you very much for having time and coming onto this program.
Thank you.
We really hope to see you from time to time to continue sensitizing the public on the dangers of this pandemic, and we hope to see when this disease will be totally eradicated. Inshallah. Well, we are with those who have come to the end of this edition of the program, COVID-19 Awareness. Do join us next time, same time, for yet another edition of the program. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
Hello Nigerians, COVID-19 is real and it's on the high side. Avoid touching your face, nose or mouth. Let's collectively fight COVID-19.
Wash your hands regularly with hand washes that have antibacterial agents in them, such as soap, sanitizer, or ashes. Coronavirus is real.
Social distancing is another protective measure in the fight against COVID-19.
Stay home, stay safe. Let's fight COVID-19 collectively.
Adhere strictly to all measures of preventing outbreak and spread of COVID-19 in Borno State.
This message is for all Nigerians. Let's collectively fight COVID-19.
This message is brought to you by Multi-Sectoral Crisis Recovery Project, Borno State.